Well, good evening and welcome to the DEBAKEY CV live studios. My name is Dr. Alan Lumsden. I'm the medical director of the Houston Methodist DEBAKEY Heart and Vascular Center. But more importantly for tonight, I am the president of the International Society of Endovascular Specialists. I'm also the envy of all the people in our group because I get to be the token guy in a symposium that focuses on training and the role of Latina Vascular surgeons. So I want to introduce Dr. Palma Shaw. She's really going to be the one who hosts this. And she's also the secretary of the International Society of Endovascular Specialists. So thank you for coming up with this idea, very important concept for the society and the women vascular surgeons in Central and South America. Palma, I'm going to hand it over to you to introduce our guests.
Thank you so much, Alan. You know, you really give me too much credit and I really give it back to you because I wouldn't be here without your support. You've been incredibly supportive and I just want everyone to recognize that. I think this is an incredible topic. I am so excited to have these beautiful women here today. I met Dr. Vanessa Rubio last year in Mexico at a meeting. I was representing the ISEVS at that meeting. She's a vascular and thoracic surgeon at the Latina Vascular de Guadalajara in Guadalajara, Mexico. We also have Dr. Fernanda Costa Silva, who I know through the Society for Vascular Surgery IRC committee. And she had previously worked for 10 years at the hospital Aristes Maltese, and now she holds an academic appointment of faculty at the Federal University of Bahia, Brazil. And she is in charge of the postgraduate program in medicine and health, and is again very active in the International Relations Committee for SVS. And Dr. Gabriela Velazquez, an associate professor and program director for vascular surgery fellowship at the Wake Forest University School of Medicine. So these are our three guests today, and I'm really thrilled again to have them here. So Alan and I thought that it would be really interesting to discuss some of the differences in vascular training and practices experienced by female surgeons from differing parts of Latin countries. Gabriela is here because she's actually originally from Guadalajara, and she's going to talk a little bit about her background. I'd like to lead off with Vanessa and ask her to discuss some aspects of the training for vascular surgeons in Mexico and what different things do you feel might be different from what we do?
Gabriela, before we start, I just want to encourage the audience to send in questions. That can be done either through the web. We'll run these banners across the bottom of the screen as we continue this conversation, or it can be done by text message. It's always better if there's a lot of interaction in these conversations, so please send in your questions and I will relay it on to the participants. So sorry to interrupt.
So Vanessa?
Yeah, it's. I think it's variable where you train in vascular surgery depending of the city. Even in the hospital where you train, there's a different program depending on each academic requirements for each hospital. For example, in order to do my training, I did 2 years of general surgery, and then I did 4 years of thoracic and vascular. And it varies. If you go to hospitals in other areas of the country, you're required to do 4 years of general surgery and then maybe 3 years of vascular, or 1 year of general and 3 years of vascular. So it really depends where you train. I think the advantage of my hospital was that it mixed a little of, the part of thoracic surgery. So it gave me a complement on that with my practice. So I think that's a good thing that I got to have. I think, I'm not sure if in the US you have this, there's not like a standard time for the years required, or do you have this variable training wherever you go? Or I'm not sure if this has the same variability. But in here, this depends where you trained and mostly the area of training you will get. Also, another thing that I think it's different in my country is that the endovascular training is not really part of the program, and I think it depends on the resources of most of the public institutions. So if you want to get some kind of endovascular training, mostly you have to do some training outside the country. So we go to Europe or the US or some other countries where we can have these practice. There are some very few hospitals in the country where you get some of these endovascular practice, which are mostly in the capital, but really very limited hospitals have these practice. So in my case, I went to training in the Arizona Heart Institute.
And you have a focus, you mentioned previously, in complex venous work. Is that?
Yeah, I really took an interest on venous cases, and I like doing a lot. I took a preference for venous cases. So I also do arterial cases, but I really like doing thrombotic cases and May Turners and Nutcracker, and so I really took an interest on all of the venous aspects. So we are starting a very strong program on venous cases in the clinic, and we're trying to promote more of these in the whole country.
So Fernanda, do you see, is this similar in Brazil, or do you see differences? And you might even, I know you're starting a new program as well. You may discuss that.
Well, the pathways are quite uniform in Brazil. They don't depend on the local, on the hospital you practice in. But there are some differences because we have to take, there is no 0-5 program with direct access to vascular surgery. We have to take 2 years of general surgery and more 2 years of vascular surgery. And the similarity with Mexico is that the endovascular surgery path is also optional. It's not part of the vascular surgery training. But we have many training centers for endovascular surgery here. We have to take one optional year separately from the vascular surgery program. And there are 2 main routes for training officially, and which consists of 2 years of vascular surgery residency recognized by the Ministry of Education, or you can take 2 years of vascular surgery fellowship recognized by the Brazilian Society of Vascular Surgery. There is also an unofficial pathway, but it's becoming unusual, which consists of 8 years of shadowing a certified vascular surgeon. But this applied when we had few fellowship opportunities, but in the last decade it increased a lot, so it's uncommon, this unofficial pathway.
And didn't you mention to me that you were starting a whole new program that you were launching?
In Brazil?
Yeah, that you were working on a project.
Oh, yes, I have. This is my personal program. This is not a residency program. Oh. This is a leadership development program called the WOVAS Forum. It's a forum for women in vascular surgery. And our objective is to connect women vascular surgery worldwide.
So you're starting today.
Well, thank you very much for this opportunity. Yes, actually, I started in 2018 when I did a study among women vascular surgeons in Brazil. We surveyed about 281 participants associated to the Brazilian Vascular Society. And we tried to delineate a profile of a women vascular surgeon regarding demographics and job market integration and the main field of practice, leadership management roles, and scientific engagement, authorship of papers. So we collected a lot of important data. And the majority of women vascular surgeons in Brazil, they prefer to practice venous surgery. This allows us to have a social life and to merge practice with family issues.
That's wonderful. Gabriela, can you please give a little bit of your background? I know you're born in Guadalajara, and then you did your education, and then you did the training here. And then maybe you could describe the training that you've done here so that the international viewers have a perception of the differences between the different training paradigms.
Sure. And again, thank you for having us today. So fun to connect this way. So I was actually born in Mexico City, and then my parents and I moved to Guadalajara, where I did medical school. And when I was there, actually in my last year, which we do like a social service, I did research, and he was my first kind of big surgical mentor, Dr. Gonzalez. He really encouraged me to come train in the U.S. I mean, at that time, I kind of already was curious about how training was in the US. You hear people talking about it, you know, you read your papers. I will like buy my books in English to kind of practice my medical English and all that. And he was really encouraging to do so, not knowing that obviously there will come many challenges ahead, but also it was a very exciting journey. So I will say that my story is very similar to many immigrants that come and pursue medical training here in the US. We do have to take the same USMLEs, and then we're considered to be ECFMGs, which is sort of like foreign medical graduates. So that's sort of like one thing that kind of covers us all if we did medical school outside the US. And then I took my steps, and then actually my first year here, I did like a couple of rotations before coming to train here at Emory University, and I worked super, super hard so that they would know that I was good and that I had a shot to like train here. And actually I had, when I applied, it is interesting as to how the first obstacles come that way when you start your interviews for general surgery at that time, because you may not have as many interviews as you thought you will have, even if you did really well on your USMLEs. I think that this ECFMG part of it may make some programs pause as to how open they're going to be to have someone from another country, just because they're not so familiar as to what medical school was like, because it's not so, I don't know, like it's not the same like it is here. So I think that, at that time I didn't get as many interviews as I thought, but because I had worked at Emory and did some rotations, I think they gave me the opportunity to start there. And all I knew is that I needed like just one shot to someone to open the door. And I knew I had to work really, really hard, because that's what we have to do. Think that I would say at the beginning, being from a different country made me feel like I was maybe not good enough. And it may have been the language barrier. It may have been the fact that I didn't do medical school in the US, and many other kind of stigmas, I guess, that we hear about when we are doing medical school, or when you hear others talking about international students training here. But I also knew that many others had made it, and that if I was there at that time, it's because I was supposed to be there. So I took a big leap and worked really hard and just keep pushing forward. And I came across incredible mentors that just pushed me the way. And after my preliminary year at Emory, they took me as a categorical resident. And then, that was kind of like the beginning of my surgical career, which I have been very grateful to have. I would say that the differences between, what Fernanda is describing in Brazil's training and Vanessa is describing in Mexico, is that we have two basic paradigms of training here for general surgery, for vascular surgery, for those that are listening from other countries. So we have the traditional program, which will be a 5-year general surgery training, where you become a board certified general surgeon, and then you do 2 years of vascular and endovascular fellowship. And then the integrated program that is now considered a 05 or 07, which basically just means that if you're going to do the extra 2 years of research, depending on the program. So, but you applied right after med school. So those are the two kind of ways it's structured overall. And there are, a couple of other things that are there that are also certified by the ACGME in terms of training, but I am the program director for a fellowship here. We do not have a integrated program yet, but I think that's part of the future of vascular surgery too, and I think that's going to allow us to capture even more trainees to be interested in vascular surgery, given that in med school not everyone will be exposed to vascular surgery. So those are sort of like some of the differences in terms of the training.
I think one other thing I find I was really curious about is with respect to mentorship and support. I feel that different women in different circumstances get different degrees of support as they come through from training, completing training, and then whether it's early or mid-career. And I was interested in seeing how, for example, Vanessa or Fernanda found different ways to gain support, because it's not an easy job. I mean, your mothers, your surgeons, and it's a male-dominated field. At least it is for us. And maybe you can comment in your respective countries how you view that for women in Mexico or in Brazil. Vanessa?
Palma, we have multiple questions that have been sent in.
Oh, okay.
Can we handle the questions? Just come on over here for a minute, and we'll let the panel handle them. So let's go from the top. So how many women are there in vascular surgery? Palma said this is a male-dominated profession in the United States. Hard to disagree with that. I would imagine it's even worse, in the South American countries. But illuminate. Let's go around Mexico. What is that, Gabriela? What is the relative percentage? Are you an anomaly, or are you the norm?
So I would say Vanessa will have a better answer, because I practice in the U.S., but Vanessa would tell you. But I think they're an anomaly for sure, in a good way.
Yeah.
In a good way.
Yeah, I think we're seeing a rise in the women that are aspiring to do vascular surgery with time, and I know that we have previous of my generation there were very few, and now they're beginning to be more people applying for vascular surgery. So I think there's a tendency to have more women each time. Right now, I would say I think we could be maybe like around, I would say maybe like around 60 to 80 women in the specialty. And that would be maybe in the whole country who are practicing like regularly, mostly younger generations, because it was harder for a woman to get in a surgical service before.
So do you have any idea what that represents in terms of percentage, that 5%, 10%, approximately?
Yeah, maybe it's around, I would say maybe that would be around a 20%.
Okay, that's
of the vascular surgeons.
That's a pretty significant number. And what about in Brazil?
In Brazil, we are 24% in 2020. The Brazilian medical demography was recently published, so I have this precise data. Among a total of 4,500 vascular surgeons, we are 24%.
All right. Now here's the most important questions. Do women get paid the same?
Yes. There's no difference in Brazil regarding to payment.
Okay. And if you want to have a child, how much time do you get off? And do you get paid while you're off?
Difficult question.
That's why we're
asking. You
mean
regarding the maternity leave?
Yes, maternity leave. Yeah.
Yes. During the residency program, female physicians have the right of 120 days of maternity leave. This is federal regulated. And they even can get more 60 days of leave, depending on the case. But during the pregnancy, they have to be removed from unhealthy activities, which can impair the training. So in practice, this means that chiefs can even ask for the woman to stop the training, for example, in the cases of radiation exposure. So they have to manage this in a case-by-case, reallocate those women, pregnant residents, to other areas.
And Vanessa?
You get 90 days for pregnancy leave, and you can either have like 30 days before pregnancy and then the rest afterwards. And then usually it's during the residency, it depends on the hospital where you train, because sometimes they will make you repeat the year of residency if you get pregnant during that year. So that's, I think that's an unfair thing.
Right.
And since I do private practice, well, this depends mostly on the time I take for my leave. But in institution, it's harder. It's usually very restricted. And there's
our institution, at our institution, we do 12 weeks, overall, but I think it also depends on the healthcare system as well. It's different for trainings too.
Yeah.
And Vanessa, this question specific to you is, do you still practice cardiothoracic surgery?
I practice thoracic surgery, like pulmonary surgery and thoracic anatomical surgery, and as well as vascular surgery. I don't do cardiac surgery anymore.
Okay. Yeah, I mean, obviously I'm coming to you from Houston, where the word cardiovascular was invented, I think. And so there are a lot of the heart surgeons here do vascular, a diminishing number. But I just was interested in Brazil and Mexico, what percentage of vascular is done by cardiac surgeons?
I think because of it's traditional that cardiovascular surgery would mainly do all of these aspects of it would be like the original specialty, for example, and then it divided. So you can have the division of vascular surgery only, and then the thoracic surgery only, and the cardiac surgery. So it depends on the hospital. There's the one where I trained is very unique in the aspect that it englobes both the vascular and the thoracic parts, but mostly you find it very divided. But most cardiac surgeons will also do some vascular surgery.
So the same applies to Brazil. There are separated specialties, and usually we are not part of the same team. The vascular, thoracic, and cardiovascular. They are completely separated teams.
All right, Palma, I'll kick it back to you to continue the conversation.
Well, Fernanda brought up an interesting topic, which is radiation safety and pregnancy, which is actually something I've done a lot of research on, and I'd be interested to know, Gabriela, in your institution, are there fellows or trainees relocated during times that they're doing an endovascular, rotation or something, or do they try to maintain the same one and just use a fetal badge?
So it's very interesting that you point that out. We don't have an actual protocol to say if you are, pregnant, you shouldn't be doing radiation cases. I think what we try to do and what we do, and we enforce that, all of our trainees get radiation safety, teaching and learning at the beginning of their fellowship to they know, and we all get our radiation badges. So as soon as we know someone's pregnant, they use their fetal badge, and they double lead. They use double lead. We also have like an extra lead protector for those that are pregnant, and we use all of those techniques to decrease the amount of radiation exposure. That being said, it always kind of makes me nervous to have them being so exposed, especially for the trainees, but they don't want to miss the cases. That's the other thing. Like, they want to continue the training. Like, if I was to tell them, hey, you don't get to scrub these cases, they'll be like, why not? I'm good with this. And the truth is that we know that if they use their double lead, they use a fetal dosimeter, they're doing all the other things to decrease radiation exposure, they will be fine. So I think that I personally, as a program director, try to be very judicious about that and talk to them about it. I talk to my faculty members to be aware of that, so that if we're going to be in a case where there's going to be a lot of radiation exposure, call it fenestrated cases, complex endovascular cases, maybe those should not be the ones that they're going to be exposed to, specific trimesters of their pregnancy. But we should probably come up with some sort of like guidelines to protect our trainees.
So we should bring that up to the APDVS.
Correct.
We definitely need to do that. Vanessa, do the trainees or the female endovascular surgeons get removed from cases because of concerns of radiation in Mexico?
No, not really. I think it's more of a choice of the resident in case she's pregnant or something like that, that she won't take part of it. But usually, yeah, it's the same thing about double lead or some measures like that you can take to prevent extra radiation in case you're pregnant. Mostly it's a personal choice, I think.
So I had 2 children, and I did EVAR, TVAR, and all that throughout. I double leaded, but this was like back in the day. We didn't know a lot of things. And honestly, since then, Weizhu, Nita Chandra, and we published a paper looking at dosimetry in pregnancy. And even with standard lead, not necessarily double lead, there was no increased amount of radiation for any of the trainees or female operators. So I think guidelines in general would be very helpful, whether we do this as a US-based effort or maybe an international effort. Radiation safety is important for all women, all who are doing endovascular procedures. So maybe that's something that we could collaborate on.
Yes.
So I wanted to see what things, like Vanessa, when you went through, what things helped you become successful at what you're doing? I mean, when the times were difficult, when you were pregnant, when you didn't feel like you could maybe get the work done, who was inspirational to you, or what things would you say helped you get to where you are?
Yeah, I think a big inspirational figure for me is my father. He's a cardiovascular surgeon. So he's a great teacher in my area, and we work together. So this is a figure that was my mentor during my training, and I would consult on him just like general surgery cases and then vascular surgery. Although he tried to discourage me from going into this field, but it was something that I ended up doing. But I think he being a mentor there and just supportive and answering my questions, and it's a role model that you try to follow. So I think this figure is very important, especially I think for every vascular surgeon, but more so I think sometimes if you're a woman, it's good to have external support from someone that will mentor you, that will help you, that will guide you, or tell you that it's not something as hard as you might think. Because I think there really can be sometimes that things are hard and you're thinking that you cannot do it if you're thinking of forming maybe like a family or having children and trying to cope with everything that represents, and also that you have to be a good vascular surgeon and be responsible and be there for your patients. So I think if you have external support, maybe like from your family, from a nanny, from something, you have to kind of plan things in order for it to work, because you have to go to a supermarket and have the food ready in the house, and then also like take the children to school, and so you have to kind of manage both lives. And I think if you manage to have this network of maybe some people helping you or like that, this will also be very valuable to kind of have both lives.
We have a saying about raising children. We say it takes a village.
Yeah.
To raise a child,
really. Yeah.
And raise a child is like a village. I don't hire one nanny; I hire like a family.
Yeah.
and then I orchestrate what their job roles are to get the kids. Fernanda, can you think of some people or some things that really got you to where you are when things were hard? It gave you inspiration.
Well, I had two role models. One preceptor and one senior resident who were inspirations for me. I had a bad moment during my residency because I heard many discouragement words, hard words, discouragement, and I lost my father in the first year of a residency. So I can say that the work, the training helped me with the grief, but it was very hard to deal with.
Yeah.
Yeah. And I had my child after the training, and incredibly, this was very good for me because he inspired me, my son, to grow in my career and to search for leadership positions and society positions, and I'm doing my master's, and I think that having a child was very good for me.
That's amazing. And Gabriela, for you?
Yes, I've been very fortunate too to have a lot of wonderful people around throughout my career. Moving from Mexico, probably Vanessa and Fernanda will relate. And in our cultures and countries, we are very close-knitted family. And it was really tough for me to leave all that behind. I didn't have anyone here in the US but myself. I basically had to become a grown-up because I used to live at home all through my med school. I didn't pay bills, didn't like my food, nothing, none of that. So I became a grown-up, and I was, so passionate about surgery and all the things that I wanted to do. So I think that having the mentors that I had through general surgery, like Dr. Dodson or Dr. Delman and Emery, that just got me through that. So the spark on me, the passion and the fire. And then, my love for vascular surgery came through, and then met other great surgeons through the way. So I think in kind of each state of my training and career has been really important to have mentorship. I would say, my love of vascular surgery started by wanting to be like my faculty members. And I thought that the vascular surgeons that were at Emory at that time, like Dr. Dodson or Dr. Corrier, they were really family-oriented men. It reminded me of home. It reminded me of my culture, that despite of them really being there so passionate and so dedicated to their patients, they were, calling home, and they were making sure that they made it to their, soccer game or this and that. And it really inspired me. And then, going on into fellowship and all that, also had a lot of, good mentors. Dr. Huber was really, really good to me, and really pushed me to be the best I could be. And I just really grew so much in terms of what I thought of myself and what could I accomplish. So I always had this kind of something missing in terms of, not having my family around. And I met my husband and all that. So I thought that I was going to come back to Mexico and practice. But then I realized that all of me becoming an adult had happened somewhere else. So I felt a little bit divided, because I felt like I didn't belong, not anywhere, because that's not the case, but it just felt weird. Like, am I going to go back? I don't know anyone. And I knew that I hadn't practiced there. My husband, he's American, and, we were not going to probably make it work at that time. So ended up staying here, and it was really, really great. And I think that, having those role models and mentors who take you through difficult times is so important in every aspect of your life. Call it, the village that you build at home and the village that you build at work. I am so grateful to be, in Wake Forest. We have such a wonderful work environment. My boss, Dr. Edwards, he's really great to all of us. My colleagues are hardworking, family-oriented. We all help each other. I personally had also a difficult time in my early years of faculty, when my husband was diagnosed with stage 4 lymphoma, and I was 8 months pregnant at that time. And, I was, working really hard because I wanted to do so well, being a new vascular surgeon, and I just felt completely overwhelmed. And the one thing that came to me at that time is like, what am I going to do? I feel so divided, because I feel like if I take time off, people are going to think that I don't care, that I'm not serious about my job. But I knew that my family needed me. And, it took my boss and some of my colleagues sat down with me and said, we got you. We got you. You are wonderful. You know what you're doing. Your family needs you now. And that's what you need to do. And if I had not had them telling me that, I would not really grow from that experience to share with my family, and kind of step away from my responsibilities at work a little bit, to be able to help my husband and have my child and spend time with them at the same time. So it was an extremely growing and experience, but also made me appreciate the weight of support and mentorship that gives you. Dr. Freischlag, she's well known in the vascular community. She's our CEO and dean of the medical school, and she was there calling me, seeing how was I doing, supporting me as well. And I mean, I think that, of course, you can think that you can do everything you want. For sure, we can do it. But having people that is doing it alongside with you, not just showing you how to do it, but just be there for the moment when you need it, it's been extremely important, and I'm very grateful for that.
I would say, Fernanda, I lost my father when I was a resident as well, and it was really hard. And my mom and I have 3 sisters. They're incredible. It's always like I'm always the one studying, and they're always picking up the pieces of things. So it's family, and I would have to say that mentors and supporters, Frank V, since the moment I finished general surgical training, has been there for me through every single hardship. I can call him anytime, and as busy as he always was, he would always take time to talk to me. And I think that if we can find a mentor who we know has really no time, and then they always care, and they will give you their valuable time, that means more than anything. It's important, and you don't always find it in your local group. It's outside, you know. I mean, I'm supported by Enrico Asher, I'm supported by Alan Lumsden, I'm supported by so many wonderful men in my career. And, you know, I think we have to just try to remind ourselves where all these people came from and how they've helped us, and then now where we've gotten, so that we can then do the same thing for our young trainees and these medical students who really look up to us. And, you know, it's hard for them too. They're scared. And we are the strong ones. And now we're in their position, right? So now things have changed. So now the onus is on us. So I was curious if any of you could think of ways that maybe internationally we could collaborate or find some joint projects that we could do, so that we could really form a bond. We could, with the backing of the ISEVS, you know, with form bond amongst the Latina community. Even we can reach out to Argentina and other different countries. Do you have any thoughts or ideas?
I think it would be interesting to have rotations maybe, because some of the aspects of, for example, maybe open surgery here, we do a lot more maybe than in other places where there's more technologically oriented and things like that. I think could promote exchange and also be interesting for just seeing how service works in another country or things like that. And I think also maybe investigation or publishing just cases in different scenarios, or I think those are things that could be interesting in our service.
That's excellent. You know, we're always trying to increase our open cases here because we're doing so much endovascular. So that, you know, whenever the weather's good, we're coming, right?
Yes.
You let us know. Fernanda, what do you think? You're pretty.
Well, I strongly agree with the idea of exchange, the knowledge, the experience among countries, and the rotations are important. But I also would suggest not only rotations for residents, but for young surgeons too. And do not worry about sponsorship, because many physicians are interested in pay the expenses for the opportunity to do a rotation outside, abroad. I mean, so I think the exchange, the knowledge is very important.
So Palma, we have a few more questions.
It could be interesting if we did some kind of a network, such as the idea Fernanda had, because this is also something very positive. If there's a fellow woman or something somewhere else that has a question, and maybe we have a similar case or something like that, this could be very interesting also.
Yes, specifically for women, encouragement is the key.
Yeah.
So I think that there are so many women vascular surgeons that could serve as role models, and they remain anonymous. We should let the world know them. And we need to invite them to female panels, normalize female panels, not only to discuss female issues, but to discuss aortic surgery and vascular trauma and so many other topics in vascular surgery, just to normalize them, to see female panels.
I had a resident for general surgery approach to me after one conference, and then she told me, like, well, she was very happy and to see me presenting, and she told me, like, because I identify with you, and she said, I think it's something possible that someday I can be doing the same thing, or that it's possible for a woman to speak in a panel, you know. And I think this is what we want, more women participation, and it's I know that sometimes these kind of topics, like just women, maybe it's seen as we're gonna complain or something like that, but I think it's positive where we can encourage participation. And like Fernanda said, I think it's good that it's not only limited to women topics, just do like different academic things, I think.
Yeah.
So Palma, we have a few more questions, if I can interrupt. When we basically look at some of them are fairly pointed. we're going to talk about them. And so, question is, what are the barriers to professional growth? Let's deal with this one first of all. What are the barriers to professional growth that you've encountered? Again, since this is really about women surgeons, specifically from a women's standpoint, I think that also covers the second question. Are there things that you've not been able to achieve that you think are related to those barriers?
I would speak to something really important, that it is not being able to find, that mentorship and that, sponsorship. Not just from women, but also from men, to seek leadership opportunities and, to put your name out there, just like we were mentioning earlier. I think that when you start your career, we're all very eager. We're all, doing our best that we can, obviously, to take care of patients and really put our name out there and really put a mark in the vascular community. And, we need people like Palma, like you, Dr. Lumsden, putting our names out there and say, I met Vanessa or I met Fernanda, and, in their clinical practice, they do a lot of these. We should put them in the list of people that we're going to invite. And I think that lack of sponsorship could be really detrimental for people when they're starting to grow their academic careers or their professional careers.
Yeah, it's a great point.
I think something that might not be really a barrier, but maybe it's a question of timing. It could be the family, because when you're raising a child, sometimes maybe you want to do an exchange somewhere else and then learn something about aortic surgery, and it's a stay of maybe a couple of months. And if you have a small child, you have to think you're also a mother, for example. So I think this is something that limits you in your professional growth. It's not that really. Maybe it will never come, but I think you have to time it when it's a better moment to do it, and thinking of your other goals you have as a personal in your personal life.
Okay.
So.
Fernanda?
Well, I haven't experienced limitations regarding the motherhood, because I had all the support from my husband. Thank God. But, I think that we should address another important topic for the societies. Especially societies play an important role in spotlighting the professionals. So in Brazil, for example, there is no selection process for committees and councils as we have in the SVS. So to get a position in the SVS, I just applied and I was chosen. But in Brazil, you must be appointed for a leadership position. Mm-hmm. So I think that professional societies, as ISEVS, should act with some transparency regarding the selection process for councils and committees, as we can know more how many women would be interested and occupy those positions. Yeah? So we should allow women to participate in the growth of the society. This is an important topic.
This last question doesn't particularly pertain to this topic, but I think it's somebody who wants to come to the United States, and is there anything they can do to make themselves more competitive? I want to pick up on a comment that Gabriela made, and that I'm an immigrant, just like you're an immigrant. And, we interview a lot of immigrants, and I say to them exactly what you said. I said, you got to be better than the American who's applying for it. The tie goes to the local person. And so as an immigrant trying to break into the United States, you got to be better. And that's just the way it kind of works here. And so just to echo what you said, you end up having to work harder, publish more, and have somebody give you that opportunity. For me, that was a guy called Mike Henderson. Once you're in, it's your job to close the deal, but you need somebody who gives you that opportunity up front. And the better qualified you are, obviously the better. So I'm going to hand it back to you, Palma.
I want to just comment on something that Vanessa mentioned. A long time ago, I met a female president of a college in Boston, and she told me that when she was trying to get that position, she was originally, it was turned down. And she said, as a woman having a child and a family, the men have a straight ascent, almost in a diagonal ascent. But women often, it's stepwise. So I'm thinking it's like aneurysm growth, right? Aortic aneurysm growth is a stepwise growth pattern. So, women in our profession, it's stepwise. So, okay, I graduate, I get pregnant. Okay, I'm a little slowed down. I can't quite keep up with the research piece. And then I get back on track, and then I have another kid, and then I take a little step break, and then I go up. But I think that, generally it's pretty well known that women, we may continue even later when we're older to continue growing and giving and looking for new venues, right, at an older age. So I think that I was disappointed once with the SVS when some years ago, I wanted to apply for one of their traveling scholarships. And they said, I exceeded the age. So I was like, well, I exceeded the age because I was having 2 kids and I just couldn't leave then. So when I wanted to do it, I was too old. Which is age discrimination, but I never really told them that. It's okay. But that's fine. But I think that we people need to acknowledge that, we women have a lot to offer. We have a lot to offer, and we may not take the exact same path as a man, but at the end of the day, we could do exactly what they're doing and maybe even better. And we're putting all our time in for it, So, Alan, do we have closing comments or?
Yeah, sure. I mean, it's been a fascinating discussion. My daughter's a resident in anesthesia out at UCSF, and she reminds me of you, Palma, in that there's never been a major challenge that she's not going to run to. What a lot of women basically don't choose an easy pathway. They always choose the biggest challenge that is out there. And so I think that's part of the beauty basically of what you can bring to it. They're so motivated and so eager to actually do a great job. And so look, clearly figuring out how we incorporate women into multiple different types of group is the key to the future of vascular surgery. You're always, in some ways respects, I envy the role of motherhood. It is a gift that you have that guys don't get. You're always going to be the mother. That's something that you should cherish. And we understand that that's something that happens in the growth of private practice and academic surgeons here. And the challenge for people in my position is how do you modify these groups? It's amazing to hear Gabriela's story and how her group supported her through what sounds like just a terrible couple of years that you were having. And that's kind of, we need the financial flexibility in groups in order to be able to accommodate people who are doing that. That's not always an easy thing to do. But I can tell you that my wife was part of a big multi-specialty group. She joined that group, then became pregnant, and they could not have been more supportive, almost like an extended family. And so I think that's the challenge in changing the surgical mentality that we've had over these years to try and kind of accommodate this. And the groups that do that will be the most successful. And so that's why, as somebody's leader of a group, we got to figure this out, because we can't be successful unless we can attract people like you to come and work with us. In order to be able to do that, we got to basically figure out how we manage through these various different challenges that occur in the life of a women surgeon that guys really don't have to deal with.
Do any of you have closing comments you want to make, Vanessa or Fernanda, Gabriela?
I just appreciate the invitation, and I really think this is a great way to get to know other vascular surgeons, female vascular surgeons, and I think it's a good beginning to start networking. Thank you.
Fernanda?
Yes, I also thank you for the invitation and for the opportunity to show my work, and I also would like to invite you, all the women connected, to subscribe at womeninvascularsurgery.com to receive the logistic plan for the first semester, and be aware that you could be invited for panels and for writing some tests for our newsletter and showing us your practice. So stay connected and follow us at social media. Thank you one more time.
Gabriela?
Thank you also for inviting us, Palma. It was really great to connect with Fernanda and Vanessa and Dr. Lumsden and you at the same time. It's just really a great way to put all these amazing brains together and really discuss important issues in our specialty. I would also encourage all of those listeners that are in the Central, South America and other countries to, if they want to pursue the dream to train in a different country or to come in the US, do not be shy to do it. You got to try it. you gotta try, and I'll be, happy to talk to you or email with you regarding kind of how some ways to do it. And just remember that, our careers are, marathons. Sometimes we have to sprint a little bit, sometimes we take it more easy depending on how life goes, but it's like a lifelong endeavor that is super, super rewarding. And I'm just really, really happy and grateful to be part of this community.
I think it's something Alan said was important. It's everybody wants to be a leader, but to be a leader, your job is to really make everybody around you better. It's not about you being better. It's about your team being better. It's about the team. And I think that people are starting to recognize that. And I think that we women will go further if we function like a team and continue to support each other, because every day there are obstacles, tough cases, and we're surrounded by men. I think it's about 14%, ballpark, women in vascular surgery, of women are vascular surgeons out of our group in the US. It's around that. So I'm really glad you guys could attend. I'm very grateful to Alan for being so supportive, as he has always been for all of our shows, and every woman that's ever worked for Alan has done very well. So I feel so lucky. And so this is great. And you all stay safe, okay? And we'll see you at the meetings. And if the ISEVS can be involved with Fernanda, your project, or Vanessa, any of these things, Gabriela, simply let me know and we'd be happy to collaborate.
Thank you.
Thank you. Bye-bye.
Bye.